Welcome to our educational video series for joint replacements. If you're watching this, that means that you've decided to move forward with having either a hip replacement or a knee replacement for me. And before we get going, the first thing I would like to say is thank you. If you are trusting me with your surgery and trusting me to help you get back on your feet and improve your activity levels, that really means a lot to me. I know that there's a lot of other surgeons who would be able to do this, and the fact that you've chosen to have me do it means a lot to me. It's a responsibility I take very seriously. And that's why I've made these videos. I want to make sure that I've assembled all of the information that I think is most relevant for this surgery so that we can educate you and give you all of the tools you need to have a successful outcome and make a good recovery from this surgery. So I'll be going through a lot of information here that I think is important and will help you to get off on the right foot as you prepare for surgery, go through surgery, and then recover from surgery. So I think one of the most important statistics to understand about a knee replacement before you move forward with it is whether or not you'll be happy at the end that you did it in the first place. Honestly, that's what matters most. It's not what I think of the surgery, it's what you think of the surgery. And the best evidence that I've been able to find on this comes actually from Australia, where they record all of the total knees that were done in the country and ask all of those patients whether or not they were very satisfied, neutral, or dissatisfied with the outcome of their surgery. And you can see here from those statistics, if you add up very satisfied and satisfied, it's 85% of people. So if you want to make it sound good, you say that 85% of people will be glad that they had a total knee. If you want to make it sound bad, you can say that 15% will be dissatisfied. And I think that the key here is having the right reasons for going into the surgery. When we do a total knee, we're not remaking what you had when you were 20 years old or when you were 30 years old. We're putting in implants that function very similar to a normal knee, but it's distinctly different from it. It's metal and plastic that moves very similarly and allows you to do things that you can't do because of pain with arthritis, but it's not the knee that you were born with. And I think if you come into it with a goal and say that I'm doing surgery, I'm doing this knee replacement so that I can blank, then it gives you something that you can benchmark against and say, okay, I came into this for this reason. I wanted to accomplish this goal. And if I can get back to doing that, then I'll be happy. Rather than saying it hurts, and if it didn't hurt, then I'd be happy, right? People who say, if I could hike, then I would be glad I had surgery. If I could get back to getting on my boat because it's wobbly getting on and off the boat and I feel like I'm going to lose my balance, or gardening or biking or any of these things, it's an incredibly personal thing. What would motivate you to have a surgery? But I think that's the key is doing surgery in order to get something back that you've lost because of your arthritis, as opposed to saying, well, it doesn't feel good right now, and if it felt perfect, then I'd be happy. So as you're working through that process, I want you to think about this. I want you to think about what would make it worth it to go through this recovery if I could do it at the end. And when we get to the end of the process, I like sharing that with my patients. I love it when people come back and tell me what it is they're doing now. Show me pictures from their hike. Show me pictures of themselves playing with their grandkids or whatever it is that motivated them to go through this in the first place. Because I think it's getting those things back that results in you being satisfied with having gone through it in the first place. Obviously, a joint replacement is a big surgery, and one of the things that you want to make sure you're aware of as you're preparing for it is what the risks are. And a lot of times when people think about risks from a major surgery, what they're thinking about are things like a heart attack or a stroke or a blood clot that goes to your lungs, which is known as a pulmonary embolism. And you can see here that the risk of all of these things is very low, but they do happen, right? And that is something that we'll touch on later on in this series. We want to make sure that you are in the best medical condition possible to minimize the risk of all of those sorts of things. And if there's any benefit to delaying surgery so that we can further optimize you from a medical perspective to make sure that we're minimizing the risk of something catastrophic like that as much as possible, we'll work with your primary care doctor to do that, to make sure that we're giving you the safest surgery possible. But here you can see for this type of surgery, what the actual risks are. Obviously, these depend a lot, though, on underlying medical conditions. And again, that underscores the importance of working through an optimization process to get you in the best condition possible before we do your surgery. Now, as it relates to total knees, obviously things can go wrong with the total knee itself. And these are the things that I worry about a lot, and that as I'm doing the surgery, I'm trying to set up so that we avoid them. But I'd like to go through them here, talk about what they are, and talk about what we can do to try and avoid them happening. The number one thing is infection. And so I feel like I'm beating a dead horse here, talking about medical optimization, but that is the number one thing that we can do to try to avoid you getting an infection in your knee, is get you in the best medical condition possible before the surgery. Very similar to what we talked about with the medical complications, it affects the surgical complications as well. And an infected total knee can be a devastating complication. And so this is why it's so important for us to work with your primary care doctor, get you in the optimal health possible before we move forward with the surgery. One thing that you'll notice here is very low on the list of reasons why total knees fail is wear. We used to tell our patients that total knees had about a 20-year shelf life, and that eventually the plastic would wear out and we'd have to take them back in for more surgery. Fortunately, with more modern implants that have been made over the past few decades, we're not seeing that issue anymore. And so anytime I'm doing a total knee, my goal is that it's going to last the rest of the patient's life. Now, obviously things can go wrong, and you can see the list of what those things are here. But anytime I'm doing this surgery, my goal is that it's going to last you the rest of your life. And with the implants that we put in this day and age, we do see them lasting long enough for that to be the case. The last thing that you'll see here is the number two reason for total knees failing is loosening. And this is generally the knee is fixed in place, typically and traditionally with cement. And so we put the tibia piece in, and we put the femur piece in, and we put cement around them. It's actually polymethyl methacrylate, more like an epoxy that's used similar to a grout. But we put those in, and then those provided the long-term bond. In patients who have strong enough bone, we now have implants where the bone will actually creep into and bond to the metal. And so this is a personalized decision that you and I can talk through in the lead up to your surgery, whether or not I anticipate that your bone quality is going to be good enough that we can use those implants that provide more of a biologic bond as opposed to cement. But in many instances, particularly in patients who have osteoporosis or soft bone, I still do use that cement so that we can avoid relying on soft bone to provide the long-term rigidity to the implant. As it relates to knee revisions, you saw there the reasons why these can be required down the line, but it can also be helpful to know what's your actual risk of that ending up being your situation. What's your risk of having a revision if you have a total knee? And part of this depends on your age. Obviously, if you're younger when you have the knee replacement, you will have that in for a longer period of time because just of your young age. And so you can see here for a patient who's around 45 years of age, the risk of a lifetime revision from an unconstrained total knee, the standard knee that we would use, is about 15%. That goes down the older you get, all the way to, if you're in your 90s, your risk of having a revision is approximately 2%. And so you can kind of, based on your age at the time you're viewing this video, plot yourself on this curve and see individualized for you just based on your age, obviously, and there's a lot of other factors that go into this, but based on your age, where you would fall in terms of your lifetime revision risk. Thanks. As we prepare for surgery, as I referenced previously, the number one thing that you can do to set yourself up for success is make sure that you're in the best medical condition possible. And this is a team approach that will involve myself, the rest of my team here at Island Orthopedics, and your primary care doctor. And this is very tailored to whatever your medical conditions are that you have in addition to your hip or knee arthritis. As a component of this, we'll get labs on you. We'll get an EKG. And we'll want to hear from your primary care provider if there's anything that they think should influence the way that we work through the surgery process with you. Additionally, if there are any specialists that you see, we may want to hear more information from them so that we can tailor a plan that meets your specific medical conditions. As you prepare for surgery, I also want you to make sure that your body has all of the things that it needs to recover from the surgery. Now, of course, I want you to eat a healthy diet, and you can see here from myplate.gov the general recommendations for what should be on your plate when you're eating dinner. As we prepare for surgery, there's a few other things that I want you to do to make sure that your body has what it needs in order to recover. The biggest thing is I want you to make sure that you're getting a lot of protein in your diet. And we actually check these levels in your blood before surgery to make sure that you do have enough to heal the wound and to form the scar around your joint replacement. But I want everybody to be getting lots of lean meats, and in some situations, people will choose to supplement their diet with some sort of protein or amino acid supplement in the lead up to surgery. And if that's something that you're interested in doing, we can talk to you about what some of those options are. The big thing is, if you're going to supplement protein in the lead up to surgery, I want you to make sure that you're doing it without getting a ton of additional sugar in your diet. We don't want you to be just getting a massive carb load in addition to the protein that you may or may not be supplementing with in the lead up to surgery. Another one that I want you to do is I want you to limit your sodium intake. After surgery, there's a massive increase in the amount of blood flow that goes to the area where you've had your joint replacement as your body is healing. And this brings a lot of fluid into the area. And we want to limit the amount of swelling as much as possible. And one of the things that can help with that is a low sodium diet. So as you're getting ready for surgery, this is not the time to be adding extra salt to your food. Again, something that will help with the swelling, which is going to be one of the big things we focus on in the recovery process. The last nutritional thing that I want to make sure we have in good condition is vitamin D. And we check these levels on you before surgery. If I pick up that those levels are low, I will send you a prescription for prescription strength vitamin D. But generally speaking, here in the fog capital of the world, most of us run on the lower end of vitamin D. So it's not a bad idea, even if you are not deficient in vitamin D, to supplement that as we prepare for your surgery. There are a few medical conditions that if you have them, we will definitely want to get them under control before we move forward with surgery. The three most common are smoking, poor diabetes control, and obesity. As it relates to smoking, if you are a current smoker, we will need you to quit before we move forward with surgery. I'll be happy to help with prescriptions or work with your primary care doctor to get you set up with management strategies that can aid you in quitting smoking, because I recognize that can be incredibly difficult. But it is a necessity, and we can't move forward with an elective surgery until you've quit smoking and we've taken a blood test that confirms that you have. Additionally, diabetes control is a very big risk factor for medical issues or surgical complications after a total joint replacement. And so if your hemoglobin A1C is too elevated, we will want to work with your primary care doctor on adjusting your diabetes medications to ensure that we get that lower so that we can minimize your risk for complications before we move forward with the surgery. The final thing, and this can be a tough conversation to have with patients, can be obesity. There are some situations where I will advise patients that it is in their best interest to lose weight before we move forward with the surgery in order to minimize their risk of complications afterwards. Obviously, these are very delicate conversations, and I want to make sure that you don't feel like you're left hanging and just told to come back when you're skinnier if you fall into that situation. I want to work with your primary care doctor or with weight loss specialists to try and make sure that you have the resources to work through that process so that we can navigate together to the finish line, which would eventually be a joint replacement. One thing that will also try to help optimize before surgery is your mental health. And in particular, we'll focus on depression. It's very common for patients who have arthritis to develop depression because we can get in a little bit of a vicious cycle between the pain from your arthritis, depression, and inactivity. And this they feed off of each other. So when you have pain from arthritis, it's hard to do things. And so that inactivity can in and of itself be depressing. If you really enjoyed hiking and now you're not hiking, you've lost something that was enjoyable, you've lost something that was fulfilling, and that can be tough. Unfortunately, that inactivity also makes your arthritis worse because the way that your cartilage gets nutrition is from exercise. And if you're finding that you can't exercise, it may cause the pain to actually worsen. And then in addition to that, as the pain from this arthritis worsens, that can make your depression worse because you're in more pain. This is now something you're dealing with chronically. And depression can then feed back to the pain and make that worse. So we know that people who are in depression will have more pain from the same physical stimulus. We had talked earlier about the concept of nociception versus pain. And the same nociceptive input in a depressed patient will result in more pain. So you can end up in the cycle you see here where the inactivity, the pain, and the depression feed off of each other and they all make each other worse. And if that's you, we want to make sure that we're treating the depression in addition to your arthritis as we go through this surgery. And we know from studies of patients who have depression, comparisons of those who are being treated actively for depression versus those who are not being treated for their depression show that they do better after the joint replacement if the depression is being treated. So it's obviously beneficial for you to be treated for depression in and of itself. It's a very, very challenging thing to go through, and it can feel like you're in a hole. But from the perspective of your hip or knee replacement, you'll actually do better in terms of your recovery if we're managing the mental aspects of your recovery as well. So this is something that very commonly I'll coordinate with your primary care doctor in the lead up to surgery to make sure that we're managing the mental aspects of your recovery in addition to the physical ones. Obviously, after surgery, we're going to want you to do a lot of exercise. That's where you kind of take things over from us and work with your physical therapist to really drive your recovery forward. The more exercise you can do in the lead up to surgery, the better it will equip you to hit the ground running afterwards. Now, the challenge here is finding that balance between what you can do without causing pain and what will be beneficial for you, right? If you had the ability to do all of the exercise you could ever want, you probably wouldn't be going through a joint replacement in the first place. And I kind of think of this like a ladder. Like the higher you are up on this ladder of exercise, the more beneficial it will be for building muscle and for building cardiovascular endurance, but it's also going to be more likely to hurt. And so the top of the ladder is running. Running is a great exercise, but most people with arthritis find that that's very challenging. As we move down from there, we get to hiking. And many people with arthritis find that they can hike uphill, but not downhill. And so unless you find a place with a slide, it's going to be challenging to do that. Moving down from there is walking. And walking on flat ground is a very good option. And I find that's where a lot of people kind of level out at as they're preparing for surgery. A step down from walking, and this is surprising to a lot of people because it's a more strenuous exercise, is biking. And so because biking doesn't involve the contact of your foot on the ground, it can be less likely to exacerbate your arthritis pain as you're getting ready for surgery. And so some people who've traditionally walked may transition either to a bicycle or to an exercise bike as they're getting ready for surgery. And it can also be a very valuable tool during the recovery process as you're trying to get back on your feet. And then the last thing on this ladder is pool exercises. Pools are great because they eliminate your body weight from the movement on your joints. And so if you are able to get into a pool and move around, you may be able to do movements that are not possible for you when you're just out in our normal environment. And so for some people, as they're getting ready for surgery, they are kind of restricted to just the pool, but it still allows them to keep moving and keep their muscles as strong as they possibly can be as we're getting ready for that recovery process. If you are in a situation where you're only able to do pool exercises, I have here on the screen a few resources for local areas where you can go to get access to those. In particular, the Fidalgo Pool here in Anacortes and the YMCA in Mount Vernon are two places that offer pool exercise classes where you could go to engage in those. And if you know of other places, please tell me, because I'm always on the lookout for more. The most common question I get asked is, how long does it take to recover from a total knee? And this is actually a really hard question for me to answer, because a recovery can mean a lot of different things to a lot of different people. For some people, that may mean just having a wound that's closed. For other people, it may be getting back to really vigorous exercise. And so this graph here, I think, provides you with the tools that you need to know where you'll be at each step along the recovery process. So for instance, you can see here that at 1 month, patients are 40% of the way recovered. At 3 months, they're 65% of the way recovered. Now, for you, recovery may mean you need to be at 100% because you want to be out doing something really active, or recovery for you may mean 50% because that's when you could get back into some semblance of your normal routine. Whatever your definition of recovery would be, you can use this curve to try to anticipate when you would hit that point in the process. Now, on that prior graph, we showed what your recovery can look like out to 1 year. But the reality is, you'll continue to get better from there as you're recovering from a knee replacement. And in this study, they looked at patients going out to 2 years, 4 years, 5 years, 10 years, and you can see there's small progress still to be made at those times. So as you're continuing to get back to normal and using your knee for the things that motivated you to have the knee replacement in the first place, we'll continue to see progress on a long-term basis. Now, there are some things about a knee replacement that are unavoidable annoyances that I can't do anything about. When we replace your knee, we're replacing the portions of it that have arthritis, but we're leaving intact a lot of other things: the tendons, the ligaments, the nerves, the skin, all of the capsule around your knee. All of these things are still the same. And so all of those things can still cause you annoyances. There are a few things that we just recognize universally are going to happen because of that. One of them is that most people end up with a numb patch on the outside of their knee because the nerves run in the skin from the inside to the outside. And when we cut through the skin, some of them don't grow all the way back through the scar. And so most people, it's about this big and it's on the outside of their knee, will say that they can't feel that area. Another one is that most people don't like to kneel on their knee. I don't have a particularly big problem with people kneeling on their knee. If you find that you can, that's great. But most patients say that it feels awkward or weird. Some of it may have to do with that numb patch that you get on the outside of the knee, but they'll choose not to. And so people who have to may use knee pads if they're working in construction or other manual trades, or they may use an extra thick yoga mat if they're doing yoga, or one of those kneeling pads if they enjoy gardening in order to accommodate this. But it's something that we know kneeling is not going to feel awesome on this thing. The last thing is that you will get some swelling, and most of that is going to be temporary. The knee will get very, very swollen after surgery, but long term, as the scar tissue forms around the knee, it does end up looking slightly bigger because of that scar tissue underneath your skin. And so it does long term look a little bit more swollen than the other side. So that concludes this first video. I'd like to thank you again for trusting me to do your surgery, and can promise you that as we're working through this process, I'm working hard to make sure that I can do the best job possible for you. Moving forward from here with this educational series, the next video is going to be more focused on the logistics of the day of surgery and your early recovery. My intention is that you would watch that one after the surgery is scheduled and you have a date picked out, and we're starting to formulate concrete plans about moving forward with it. The reason I've broken it up like this is that all of a sudden, right before you have this surgery, you're going to be very focused on one thing and one thing only, which is, hey, this is going to hurt. What are we going to do about that? And that's largely the focus of that next video. It's more on short-term considerations as opposed to the long-term considerations that we talked about in the video today.